I'm Peter Galbraith, and I'm a candidate for the Vermont Senate. And the main reason I am running is because of the opportunity that we will have in the next session of the Vermont legislature to do something meaningful about health care. This year, the U.S. Congress passed the Federal Health Care Reform Act, which is the most important piece of health care legislation since the 1965 Medicare Act. It is a great step forward and a great credit to President Obama, but it only goes so far. It covers 70% of the people who are now uninsured, and it does not include what I and many Vermonters wanted to see, which is a full public option. But next year, we in Vermont will have an opportunity to take this further. One of the things that we can do right away is to enact a Vermont public option, so all Vermonters will be able to choose a public health care option as well as the private plans when the exchanges, the federal exchanges, come into effect in 2014. The best system for health care is a single-payer system. It is the fairest, it is the most efficient, it has the lowest administrative expenses, and it is the way to cover everyone. It is the system that virtually every other industrialized country uses. But it is difficult for one state to move to a single-payer system on its own because so much of the government money for health care comes from the federal government. Fortunately, Senator Bernie Sanders included in the federal health care bill an amendment that allows states to experiment with a single-payer system from 2017 onwards. And that amendment would allow Vermont to make use of Medicare and Medicaid dollars to support a single-payer system. Now, 2017 may seem like a long way away, but when you're making major changes in in government programs, it's just around the corner. So I also want the Vermont Senate to be moving forward to take advantage of the Sanders Amendment, recognizing that there still will be challenges and that whatever we do, we have to do in a fiscally responsible way. But the bottom line for me is that health care is a fundamental human right, and that we should do everything we can in Vermont to make sure that every Vermonter has coverage that will serve her or him and children and seniors. Thank you.